Good afternoon. Thank you all for joining us here today as we continue to respond to COVID-19 and the effect it is having on people in our community. I want to thank you all for joining us to discuss this important new initiative. Joining me here today is Rochester Mayor Lovely Warren, Monroe County Public Health Commissioner Dr. Michael Mendoza, Jordan Health Chief Medical Officer Dr. Lori Donahue, Trillium Health Chief Medical Officer Robert Birnbaum, and Dr. Wally Johnson, Director of U of R Medicine Primary Care Network and Associate Chair for Primary Care in the Department of Medicine. We know that COVID-19 does not discriminate. Anyone can get it, regardless of age, income, or background, and we all need to take steps to stay safe. But we also know that some communities are disproportionately affected. In our community and all across America, racial and ethnic disparities in healthcare have existed. These disparities are now being exacerbated in light of COVID-19. We can see the evidence as we look at the number of COVID-19 patients being hospitalized and sent to the ICU. Here in Monroe County and across the country, people of color are disproportionately dying from this horrible disease. That is why Rochester Mayor Lovely Warren and I have been working together to rapidly expand access to COVID-19 evaluation and care within the city of Rochester. Working collaboratively with Jordan Health, Trillium Health, and the University of Rochester Medical Center, we are excited to announce the addition of 2 new respiratory evaluation clinics within the city limits. Jordan Health opened its clinic to a limited number of patients today. Trillium Health will open tomorrow. Both have plans to ramp up quickly, and Trillium will soon launch a mobile unit to make sure that these critical services reach all who need them. Dr. Donahue and Dr. Birnbaum will explain how these clinics will operate, and Dr. Johnson will talk about how URMC is supporting this initiative. First, however, I'd like to invite Mayor Warren and then Dr. Mendoza to say a few words about the critical importance of this effort. So thank you, Mayor Lovely Warren, for your help and partnership on pulling this together, and I'd like to hand this off to you to say a few words.
Thank you, County Executive Bello, and thank you for your leadership during this crisis. You have done a yeoman's job of pulling our community together, and I appreciate all that you have done for our entire county and especially for the city of Rochester. I also want to thank Dr. Mendoza and the team at the County Health Department for the great work that they're doing, as well as our community partners that the County Executive and I are announcing today. We all prayed that this day would not come and we would not see this in Monroe County, but nearly 90% of COVID patients in our ICUs, over 65% of our patients on ventilators, and nearly 40% of the people that have died from this terrible disease in our community are people of color. This is a travesty, and communities of color around Monroe County make up less than 25% of the population. That is why this announcement today is so critical, and I'm thankful for the County Executive. We need more testing, and we need more testing focused on communities of color so that we can identify and treat those that are sick earlier, contact tracing, and doing what we need to do as a community to make sure that those people that are sick are getting the treatment that they need. The numbers show, as the County Executive has outlined and have been talking about for weeks, that this disease must be taken very seriously by everyone because anyone can get it, but particularly by our Black and Brown residents who already face numerous challenges, we know, but they should not continue to suffer in not having access to the right testing that they deserve. I am thankful again for the partnership that we have in County Executive Bello and Health Commissioner Dr. Michael Mendoza. When members of the Black Political Caucus raised this concern about what we were seeing around the country and the disparities that we were seeing around the nation, they not only took our concerns very seriously, they stepped into action. And because of them, we have this partnership with Jordan Health Center, Trillium, U of R Medicine, and Rochester Regional Health to expand testing, but not just to expand testing, but to expand treatment in communities of color that have been challenged by and affected by this disease. Together, we will do all we can to protect this community. Please follow the advice of the medical professionals you will hear from today and in the days ahead. This expanded testing will make a difference, but ultimately, it will be up to me and you. We must protect our circle. We must stay home to save lives. And if we have to go out, we must maintain social distancing. Together, we can and will emerge from this. And I know that brighter days are coming, but it's up to all of us to do our part. And I'm praying for God's grace and his mercy. Thank you, County Executive Bello.
Thank you, Mayor Warren, and I appreciate your work working together to bring this collaboration together. This is a true community collaboration and effort to try to impact the health disparities that exist across our community, and I appreciate the ability for all of us here to work together on this. And I would like to then also offer an opportunity to Dr. Michael Mendoza, our Commissioner of Public Health, to offer a few words.
Thank you, County Executive, and thank you, Mayor Warren, for joining us today. I think this is a very important initiative that today we are undertaking in the best interest of ensuring equity with regard to access to screening, to testing, and ultimately to care and outcomes for COVID-19, and certainly for the wide variety of other health conditions that we know exist and inequities and disparities here in our community. So in that vein, I want to thank Trillium, Anthony Jordan Health Center, and the U of R Medicine, and in particular, Dr. Lori Donahue, Dr. Rob Birnbaum, and Dr. Wally Johnson, who you will hear from shortly, for their collaboration. Now, this is a collaboration that dates back many, many years. What you're seeing today emanates from a long-standing relationship and commitment to addressing and preventing healthcare disparities and health inequities in our community. And my hope is that our efforts today represent just that. As we go ahead, we know that we're in a plateau right now. Our numbers have indeed flattened out a bit. And I want to recognize the community and all the leaders in our community who have stepped forward to implement what, by every measure, is a very difficult and very uncomfortable intervention, which is social distancing and all the other things that went into that. I will add that we are not out of the woods, and I think it is especially important that we undertake a wide range of testing, in this case, looking for current infection, recent infection, as well as in the near future, hopefully, antibody testing to document whether individuals across our diverse community have been exposed and are in fact immune to COVID-19. But we have a long way to go, and I think today is a first step in the form of collaboration across our system. So regardless of what background you come from, where you live, what socioeconomic status you might occupy, today is about commitment to equity and to identifying the health disparities that we know are here in our community. We know that we need to continue to test. We are far from out of the woods, but as I said earlier, I think today is an important first step in the right direction. So again, I want to thank Mayor Warren, County Executive Bello, Trillium, Anthony Jordan, and UR Medicine for your ongoing partnership. And we here in the Health Department stand ready to support you in any way possible. With that, I'm going to hand it back over to County Executive Bello.
Great. Thank you, Commissioner Mendoza, and thank you on behalf of all the residents of Monroe County for the work that you're doing to protect and keep all of us here healthy and safe. And like I said, this is a great partnership, and I would like to now we'll turn this over to the folks at Jordan Health and Trillium Health, who can talk a little bit about this new effort and how this is going to work. And I want to start by thanking Dr. Lori Donahue from the Jordan Health Center. She's the Chief Medical Officer for your help and work on this, and for answering the call and rising to the challenge to better impact and serve our community. So Dr. Donahue, I can turn this over to you.
Thank you, County Commissioner Bello. Thank you, Mike. About a month ago, when this all came to light and we knew that things were going to be ramping up in Monroe County, we knew that the community that we serve, the city of Rochester, was going to be especially hard hit. Not only was it going to be dealing with the medical care for this virus, but also the social impact that this was going to have. So it was important to us that we had available, not only for the people that we serve as Jordan patients, but also through our urgent care, the ability to not only get tested, but also get information and reassurance about the care that will be provided for them within the city of Rochester. We also know that testing is not going to be enough for the people that we take care of. They don't have access to transportation. They don't have access necessarily to social distancing within their homes because there are many people living in very small spaces. Additionally, they don't have access necessarily to food, to other needs that they might have. So when we began to talk about what our patients at Jordan and also the patients within the city of Rochester were going to need, we wanted to have a more holistic approach to this. In addition to providing clinical care in a respiratory clinic, we want to have available to people our social work group, our community outreach workers, our financial counselors, folks who can help with transportation to figure out what are the barriers to care so that we're being sure that the needs of the families that we serve are being taken care of. We're working hard not only to take care of folks who are experiencing the virus, but other family members who might be exposed at the same time. At the same time, we're also trying to take care of the children in our community who need to continue to access care for immunization and other preventable diseases. So our approach at Jordan and with our work with the county and the city, as well as Trillium and the University of Rochester, we were able to set up a specific respiratory clinic, again, with access to all of the services that we know that our families are going to need as we're addressing the particular outcomes and the particular burdens that our families are facing.
Great. Thank you, Dr. Donahue. Thank you for that, and thank you for your approach to this as well, this holistic approach to health, and we appreciate your partnership. I would now like to call on Dr. Robert Birnbaum, who is the Chief Medical Officer from Trillium Health, who can talk to us a little bit about what they're doing at Trillium Health.
Thank you, County Executive Bello, and thank you for having me on to talk about what we're doing and the partnerships that have been long-lasting in this community between all the health systems. So similar to Dr. Donahue, Trillium, when this started, knew that our patient population, which primarily exists for communities that live in the city of Rochester, this was going to be difficult for them. So we started out the journey by ensuring that there was no gap in care for Trillium patients. We've been doing telemedicine visits since the middle of March and continue to keep the same volume for our patient population at both of our medical locations for our adult patients on Monroe Ave and our children that we take care of through our division called Pathway Pediatrics on Science Parkway. But we also started to realize the significant disparities for our patients and communities of color in the city of Rochester in terms of availability of testing and their availability of getting to testing locations. So starting next week, actually, with a soft start on Monday for the first 3 days, and then Thursday opening up to the entire community, specifically really focusing in on the communities living within the city of Rochester. Trillium is opening up what we're called the COVID respiratory evaluation area, which is distinctly separate from our medical clinic on Monroe Avenue. And we did that purposely. We still have people who are not showing symptoms who are walking into our clinic, and we're maintaining a skeleton crew of providers to manage those patients, whether they are medical or psychosocial needs. Our respiratory clinic is going to be staffed by medical providers, both physicians, physician assistants, and nurse practitioners. We're setting up a new COVID hotline for both our patients and the community to call in and have an assessment over the phone by a registered nurse, followed by the availability to see one of us in our respiratory area. We also, similar to Jordan, are ensuring that our patient psychosocial needs and financial needs are met by supporting them with our care management team and our financial counselors if need be. It's also mentioned that we're working right now with the county as we have a mobile access clinic to see areas of the county that may not be able to reach one of our testing centers through Jordan or ourselves or University Medical Center, Rochester Regional, and determine areas of the city where we could actually go to them to have providers available for both respiratory evaluation and or testing. We're definitely grateful at Trillium Health for the partnerships that we have in this community and just an amazing rapid response and partnership with all the providers on this call today.
Thank you, Dr. Birnbaum. We appreciate it, and we appreciate the good work that you are doing for the citizens here in Monroe County. I would also like to thank and welcome and join to the press conference today Dr. Johnson, who's the Director of U of R Medicine Primary Care Network and is the Associate Chair for Primary Care in the Department of Medicine. And I want to thank Dr. Johnson and all of his colleagues at the University of Rochester Medical Center for their work on this issue and their partnership in treating the entire community here. We really appreciate the partnership here. And Dr. Johnson.
Well, thank you very much, Mr. County Executive, and I'd also like to thank the Mayor for facilitating this conversation. My remarks will be brief because it's really what the Trillium and Jordan folks are doing that's exciting here. UR Medicine continues to work hard to serve our entire community, which includes this continued collaboration with Trillium and with Jordan Health. Our labs at UR Medicine have succeeded in building capacity now for testing both Jordan Health and Trillium patients, absolutely consistent with what we've been offering across the UR Medicine primary care and hospital network. And we've also made an effort to share our experience and our processes for setting up a respiratory clinic, which has highly trained staff in the appropriate personal protective equipment, as Dr. Birnbaum and Dr. Donahue stressed. And I think all of us really understand the importance of testing, but also UR Medicine, Jordan, and Trillium are committed to care and not just testing. Thank you very much. Jordan and Trillium are committed to care.
Whoops. Sorry. Thank you, Dr. Johnson. And I cannot thank all of you enough, Mayor Warren and all of our partners for helping to get these clinics off the ground so quickly and for working together to do so. One of the things that have come out of the challenge that COVID-19 has brought to our community is all the different partnerships that have formed to greater serve the residents throughout our community. And this is just another partnership example of those partnerships that are trying to make an impact in people's lives. Together, all of us here who are here today are working to reduce health disparities, and especially in light of COVID-19, and ensure the health and safety of our entire community. And I know I will join Dr. Mendoza in reminding all of you that we should continue our safe social distancing practices. We should continue to stay safe at home. And when you need to go out for essential services, please stay and remain 6 feet apart from others. And when you're in public, to continue to wear a face covering or a mask so that we can protect all of those in our community and everyone around us. It's best to stay safe at home and to wear that mask and face covering. So now I'm sure you may have some questions, particularly for Anthony Jordan Health Center and Trillium Health. And I'll have Julie Phillip here on my team ask each reporter and call on each reporter in order to ask questions.
And try to keep your questions brief and direct them to one of the panelists if possible, just to keep this moving along. The first question is from Patrick with WHEC, and Tanner Jubinville from 13 WAM should be standing by. Thanks.
I think, Patrick, you might be on mute. Okay.
To Tanner Jubinville.
Hello, this is, sorry, this is Charles Maldonado with WHEC.
Okay.
Patrick was listening, but he may have stepped aside. I was actually going to speak to Dr. Mendoza and ask about the decision by the state to relax restrictions on elective procedures, obviously a big consideration for a lot of non-COVID related medical issues. Your first response, where does that put us? What's the situation out there in our healthcare facilities?
Well, thanks for your question, Charles. And yes, this is new news for us. I think it's an indication of all the hard work in our community that got us to this point. As you probably noticed, we are among a select few number of counties who has been given the green light, so to speak, to start going down the path of beginning to conduct the so-called elective surgeries. As you can imagine, this is going to be a game changer for our community because we know through a variety of sources that many of our community has not been able to access care, elective care, because of these restrictions that we put into place. So, certainly there are the economic reasons why we want to restart the health center, but I think the more important consideration for our hospital systems is that we want to provide high quality care to our community. And we know that the first way to do that is to reopen slowly, methodically, with a lot of thought and care to ensure that we can continue to take care of our community. I just got a meeting with my team where I've asked them to be on the lookout for any markers in the data that we are seeing that might be an indication that we need to reevaluate our decision to go forward with these elective surgeries. The reality is that these elective surgeries we do not believe will heavily tax the inpatient wards, but I do think that's a metric we're going to have to follow going forward. But we certainly do not want anybody in our community to delay care. We have a backlog as it is of 1 month's worth of unmet demand for healthcare. And I think this is a step in the right direction, but I think we need to have ongoing conversation, make sure we're looking at the numbers as they go by to make sure that as we revisit this decision, that it remains the right one for our community. So lots more planning to be had. We're going to be meeting tomorrow and in the days to come to put some more flesh on the bone, so to speak, as to what that might look like. But this is certainly a very important first step.
To ask a different question of Dr. Mendoza, his letter to Commissioner Zucker regarding Hurlbut Nursing Home, you're expressing some pretty serious concerns. Can you explain what they are and what you're hoping to get in the way of answers?
Well, these are serious concerns. We are very concerned about the healthcare status and the health status of our loved ones in our local nursing homes. And that's why I was very relieved last week to learn that the State Department of Health has called upon all of the nursing homes across the state to report in a timely fashion on the outcomes with regard to COVID tests, as well as any fatalities that occur within their residents. And, we saw the first report this past Friday, and we saw one of our nursing homes represented there. And I'll be honest with you, that was surprising to me. And I had to ask myself, well, is there something in the reporting mechanism that still needs to be worked out and so forth? But then I will say that in the DNC report yesterday evening, which I want to thank the DNC for shining a light on this issue, not just yesterday, but throughout the entire crisis, called to mind something that was very concerning to me, which was the supposition that the local health department, the Monroe County Health Department, was receiving reports from Hurlbut, and that's just not true. The reality is that we know that the nursing homes are obligated now by last week's mandate to report those data to the state. We've never been in a relationship with the local nursing homes where they've had to report any of these data to us. And so, that raised some concern on my part. It certainly doesn't speak well to the quality of service that we want to provide here in the health department. And so in light of all of these findings, I found it really no other option but to ask the State Department of Health to explore this discrepancy and provide some transparency to our community.
Okay, next up is Tanner Jubinville from 13 Lamb, followed by Ketsia Rodriguez from Catholic Courier and El Mensajero.
Hi, good afternoon. First question is directed for Dr. Mendoza. Can you hear me?
Yeah, go ahead.
Good. This is related, but have been on your radar before that report?
Well, when you read reports of people in our community who have passed away, and that's always going to be on your radar. And we saw those reports over the last several weeks. We read the heartbreaking stories of family members who had lost loved ones, and so absolutely, it's been on our radar. Which is why it was even more surprising to me not to see those data validated in the report that was released by the state. And so, I think there is, some growing pains that we need to tolerate here, but the fact is it doesn't seem that Hurlbut has been fully transparent with regard to the reporting to the state. And so I want to make sure that we offer that transparency again to the community.
And the second question is for doctors with William and Jordan Health Centers. I just wanted a little bit more about these respiratory clinics. I guess just basic stuff, locations, and how many patients could you potentially treat at one time?
Yeah, so at the Jordan Center, it's actually at the Anthony L. Jordan Health Center on the corner of Hudson and Holland Street. We fortunately opened up a new wing on the first floor there in the past year. So we were able to isolate off several exam rooms. Between 9 o'clock in the morning and 3 o'clock in the afternoon, we'll be scheduling appointments for our Jordan Health patients. We have been running a triage hotline for COVID-19 for the last month. So we're well able to get people scheduled. We also will be dealing with folks who potentially could be walking in. Anybody who presents at our health center is masked right away. So, we are protecting everybody, staff, and anybody visiting our center. From 3 o'clock to 8 o'clock, our urgent care center will be open. We'll continue to run the respiratory clinic for folks presenting to urgent care. Again, we're asking that people call ahead so that we can give folks a specific time to come in so that they can be clinically assessed and determine whether or not they would need testing at that time.
Thank you. Next up is Ketsia Rodriguez from Catholic Courier and El Mensajero, and then we'll have Andrew Freeman from Spectrum.
Thank you, Julie. No questions at this time.
Okay, thanks, Ketsia. Go ahead, Andrew. Andrew Freeman from Spectrum.
Sorry, I was having trouble unmuting myself.
Okay.
I just wanted to open up specifically, either anybody can answer this, I guess, but I guess, of course, this is in part hoping to combat, ethnic disparity in the community when it relates to this virus. And I was just wondering, how important these steps were and what kind of impact you hope it'll make, doing things like this when it comes to ethnic disparity.
I'll address that, and then Rob, I'll give you a chance to jump into as well. As we know, the impact of poverty on health is huge, as well as chronic diseases in folks who are immunocompromised. So because we see a lot of these patients anyway, we do know their health histories. So, we're able to sort of pull all that information together and have a good sense of the impact that the virus potentially will have on folks as well. The other thing that I think is important for us is the ability to be able to follow up with people. Our Jordan patients, will be coming back in for other medical issues as well, but being able to contact people, being sure that, that when we do testing, that we have a means to get folks in for care if they need it, and also working with the University of Rochester, being sure that folks who might need chest x-ray, because we are able to do that on site at our Jordan Health Center, would have access to that, so that hopefully that we could, for particularly folks who are dealing with other chronic illnesses, we can catch the effects of this virus before they lead to emergent care, ICU care, intubation, and ventilator need.
I would echo what Dr. Donahue has mentioned. I think what's important from racial and ethnic disparities is the lack of ability for people to understand that evaluation and testing is going to be available to them. I think what Mayor Warren had mentioned, the fact that there is some significant disparities in terms of communities of color, being the most ill patients when it comes to COVID-19 really reflects on the fact that we all need to do more. And I think, you know, what Dr. Donahue was talking about is something that we really are taking to heart at Trillium Health to ensure that not only are we going to have that hotline for our own patients, which we've been doing now for over a month, but, you know, starting next week, really open this up to the community for two reasons. First reason is we're located on Monroe between Union and Alexander, which is right on the bus line, which is easy access to inner city patients or inner city communities who don't have primary care. So not only do I feel it's important for us to be able to serve not just Trillium patients, but the community as a whole, and to be able to follow up with patients that we see in our respiratory area to ensure that not only is this being taken care of at possibly an earlier intervention, but ensure that their chronic medical needs are going to be met by us or other members of this community.
A follow-up, Andrew?
Yeah, as far as rolling these services out, are they going to be subsidized by the county or city? Will people have to pay out of pocket for these services at all, or, you know, are they, you know, Medicaid, using Medicaid and that kind of thing?
So I can let one of the systems talk a little bit about that cost structure through their systems, but one of the ways that the county is partnering through this process is through the delivery and help with the management of personal protective equipment to help to make sure that this is done in a safe way as we work with other healthcare providers around the community and other systems, as well as providing access to test kits that have been made available through the state of New York. So this was a great, I think, way of being able to use those resources to partner with Trillium and Jordan Health to provide that service.
Yeah, and I think, you know, as Rob was saying, and at Jordan as well, no one should avoid care because they're afraid of getting a bill or inability to care. That's why we have the financial counselors who will be available. Folks who qualify for Medicaid will help to get them enrolled in that. Folks who don't, you know, for the clinical services, we have a sliding fee right up to $0. And actually our mission is to provide care for anybody regardless of their ability to pay. So if there is a take-home message to the community today, no one should avoid care because they're afraid of getting a bill.
Thank you.
And from Brett Dulber.
I might have to say that again.
I'm sorry. Next up, we have Brett Dulber from WXXI, and Christian Garzone from WROC should be standing by.
Al, thanks for talking with us. I know that we had a list of people who are being prioritized for testing when tests were more limited, and it was mostly for people who were hospitalized with symptoms or were healthcare workers or were first responders. Are we at a point right now, I think this is probably for Dr. Mendoza, are we at a point now where we are adding people of color to that list of folks who are prioritized for testing? And why or why not?
Well, I think, you know, the first point I would make is that I rely on my colleagues across the community to use their clinical judgment. And I think it's hard to ignore that disparities exist in our community. And so to the extent that an individual may be caring for somebody for whom disparities may be applicable, I think it's perfectly reasonable for them to offer testing when appropriate. But I think the medical indications are still the most important ones. You know, the extent to which a test result will change the management for an individual is still the number one consideration when ordering a test. But I think it's fair to say that the guidance has changed in the month or so since the state DOH initially issued their recommendations for testing. And so I think as the needs evolve in our community, as we learn more about disparities that are evolving in our community, I rely on my counterparts and colleagues across the community to do the right thing. And I certainly would support testing for you know, people of color and underrepresented minorities.
Do you want to follow up, Brett?
I do, thanks. What explains why deaths seem to be largely tracking with the population distribution as far as race and ethnicity go, but hospitalizations and in particular ICU admissions are not. Why are those disproportionate, but deaths seem pretty proportionate to population?
I think that's a story for the ages. I think that is a question that we're going to come back to. I think we need to do more more analysis here. One bit of analysis that we have yet to do is an age adjustment of all of these data. But I think the fact of the matter is that we don't have enough data. I think we have enough experience in this community to know about disparities, to know to look for these disparities, and to anticipate them and address them and prevent them to the extent possible. And so, I think the data not showing what we might expect is, I think, more a function of the data than it is a function of reality.
Okay. Thanks.
Thank you, Brett. Next up is Christian Garzone from WROC, and Patty Singer from Minority Reporter will be next. WROC?
I don't see them on the list anymore.
Okay, well, we wait to see if they're still on. We'll go to Patty Singer with Minority Reporter, and Will Astor from the Beacon should be standing by.
Hi, thank you. I want to follow up on the testing question. So do these individuals still have to be symptomatic, or is testing now opened up in communities where anyone, even asymptomatic people, should be tested?
I'll take that question if that's okay. I think, we've learned a lot about the test properties as the weeks have gone by, and we now know that asymptomatic transfer, pre-symptomatic transfer is very much a possibility. And so again, I leave it to my colleagues to assess whether, ordering a test in an asymptomatic individual is appropriate. But we certainly know that in higher risk populations, anybody in the hospitals, anybody in a nursing home, first responders, healthcare workers, and so forth, I think it's very reasonable to order, testing for an asymptomatic individual. And to the extent that our communities of color work in these professions, I think it's absolutely important that we do what we can to screen and understand ultimately the community prevalence, because that is the data point that will help guide us out of these woods, so to speak.
Follow up, Patty?
Yes, please. How does this working with Jordan and working with Trillium go into the messaging that County Executive and the Mayor wanted to do about social distancing in communities of color? How does this these respiratory clinics play into the prevention message that's going to be rolled out?
Well, there's prevention and there's treatment, but I think that the prevention message is the same across the community, which is that we need to listen to our public health care professionals when it comes to social distancing and taking proper precautions to protect your health, but also as importantly is to protect the health of others around you. That is the whole point behind even having the community masking and face covering, is to make sure that, for a lot of us, we may, and the science has changed as well. And Dr. Mendoza has talked a lot about this, and so has the CDC, that what has come to be learned is that you can be asymptomatic, still have the virus, and be able to spread it. And so, while a vast majority of us may contract the virus and be completely fine, I'm a relatively healthy person. I feel like if I got the virus, I'd probably be okay. But I would still be a vector for being able to spread it. And so, it's a responsible thing is to wear a face covering, wear a mask, and stay 6 feet apart from somebody else, because what we really need to do is work very hard to keep keep ourselves from becoming that vector for spread, and we need to work very hard to keep the virus from spreading to more vulnerable people, where the outcome for contracting the disease could have a far more serious effect and a far more serious outcome than it did to the vast majority of us who would get it. So it's a very unselfish thing to do, is to wear a mask and to stay 6 feet apart and to follow the advice of the health professionals. And we will get through this. And as what we know about the virus and changes over time, and what the professionals tell us as we learn more, because remember, this is all very brand new, we'll continue to follow those guidelines and change those guidelines. But I think it's very important that we follow those recommendations. And then I'd ask my friend, Mayor Warren, if you'd like to add anything as well.
Just quickly, County Executive Bello, I agree with 100% of what he said, but I also want to highlight what Dr. Donahue and Dr. Berman have indicated, where the testing being located within a community where people reside is very important, and having access to that testing. And I believe that that is part of the reason why the county executive and Dr. Mendoza and I have been working with these community partners to make this happen, because we don't want people having to get on a bus. They can walk to Jordan Health Center if they live in Northeast Rochester. They can get there rather easily. The same patients that Trillium sees, they're used to going and getting services at Trillium, and they're located right in the community. And I think that that's very important when we're talking about making sure that we are recognizing the disparities that already lie in the population, that we're trying to serve, and providing them the access that they need within the communities that they reside, so that they can practice social distancing while going to the doctor and getting the help that they so desperately need. I think that that is so very, very important at this time.
Okay, thank you. Next up is Will Astor from the Beacon, and then Bud Lowell from WHAM 1180 will ask a question.
Okay, first question is, could you clarify the staffing of these respiratory clinics that will be set up? Are they done with existing staff from Jordan and Trillium, or are there personnel coming in from the systems?
At Jordan,
Trillium Health, sorry, go ahead, Lori.
No, I was probably going to say the same thing. At Jordan, it is all our existing staff.
Same with the Trillium Health.
Okay, and my next question is for Dr. Mendoza on the resumption of elective procedures. How slowly are we going, and under what circumstances would we pull back or revert on that?
You raise a good question, and this is something that we're still actively discussing, because we want to go only as slowly as necessary. Because again, the goal is to promote health and promote access to important services. And we want to do that obviously as safely as possible. So beginning tomorrow and in the coming days, we're going to be gathering our data and developing sort of metrics that will allow us to anticipate, because we certainly don't want to identify a problem when it's too late. And we know that the data that we see is generally a reflection of what the community was doing a week or two ago. And so that's the additional wrinkle here, is that we've got to be nimble with how we look at our data, and be in constant communication with our partners in the healthcare system to alert them to anything that might suggest that we might be entering a surge that will affect the capacity in our health system and increased demand on the part of patients who have COVID in our community. But we'll be following all of the precautions, and we certainly don't want to peel back social distancing any faster than we need to. But the reality is that we can't stay in social distancing forever. None of us wants to, and the health outcomes of our community depend on us to move forward in a methodical and thoughtful way.
So if I could just get a clarification, then we're not actually resuming elective procedures right as of now, but we're looking at how soon we might be able to resume it, and what level of procedures we might do at some future point.
Yeah, those are details that we're still working out with in conjunction with the governor's office and the State Department of Health. So when we have additional information to share, we'll be sure to pass that along.
Okay, thank you.
I'm not seeing Bud Lowell on. Is anyone from WHAM 1180 on? Okay, we're going to move on then to Brian Sharp from the Democrat and Chronicle with our final question and follow-up.
Thank you. I guess I think these will both be for Dr. Mendoza. When we talked previously, and you've said since, that the test that we have right now is, I think your words were, a bad test given the false negatives. We've also seen, I think, these swab tests at Walmart where they hand it to the person, they hand it back. There was some antibody testing up at TOPS. I'm just wondering if there is any concern, while there is need, about false negatives spreading false information in these communities, and how you sort of rectify those two potential needs and messages.
Sure. So let me go back and clarify what I meant by a bad test. There are no bad tests. There are only bad interpretations. And so what we need to do is utilize these tests in a thoughtful way. And so the tests, the limitations therein, they're going to apply to the entire community, which doesn't mean that we don't use them. It just means that we need to use them thoughtfully. And we need to look at the results in the context of the presentation of the individual in front of us and make a clinical judgment as to how to give proper advice to that individual. And so, yes, there are some false negatives, upwards of 25 to 30% in this current test. And we largely think that's because of operator behavior and the extent to which somebody can actually gather the specimen accurately. We are working with our partners at Trillium and at Jordan to ensure that they have all that they need to administer the test in a high quality way. And therefore, we'll be able to utilize the data and make good interpretations. But the limitations notwithstanding, I think we need to plow ahead. And we're never going to have a perfect tool, but I think we need to use what we have and learn as much as we possibly can.
Great.
Do you have a follow-up, Brian?
My follow-up, just to go back to, I think am I unmuted?
Yes, go ahead.
Just to go back to what you have said about, again, to Dr. Mendoza, what you have said about the situation with the nursing homes. If I heard you right, it was that you had said you were surprised when the first report from the state came out and St. John's was on there, but that you were aware of the deaths, and that's why I think it needs clarification, at Hurlbut, but we're surprised that they hadn't been confirmed by the state. I'm not clear on, I guess, exactly what the county knew of nursing home deaths and what they were surprised to learn.
Well, if I recall correctly, the reporting out of the Democratic Chronicle is what gave us the knowledge that we ought to be anticipating something from the report that came out of the state. As you all know, we gather data here, and my only reservation about sharing the data is that I don't believe it's entirely accurate. We gather data, as I've mentioned in the past, from a variety of sources. Often for deaths that occur in the nursing home, we are generally never informed of them by the nursing homes. That's never been the practice anywhere here in the county. And if we happen to know about them, it's either incidentally because we're reading the obituaries in the paper, or we hear about it through other means. And sometimes it's through journalism from PNC and your colleagues that brings this to our attention. But we've been following this. We've done contact tracing. We have what we believe is an underestimate, but the question really is it off by a little or off by a lot? And that's been the reason why I've always been hesitant to release information that I don't believe is accurate. And so that's the reason why I want us to get collectively behind the State Department of Health to dig into what is accurate and to offer that transparency to our community.
Thank you all very much. Thank you, Dr. Mendoza. And I want to thank Trillium Health and the Jordan Health Center, also our friends at the University of Rochester Medical Center, Rochester Regional Health, and of course, my partner, Mayor Lovely Warren, in government here. We worked together, started this process just a little while ago when we were able to start really looking at data coming out of the Department of Health, and I want to thank Dr. Mendoza and his team for that. And we started these conversations around how can we look at how better to make sure that we have better outcomes amongst all of our residents. And I think this was a really great collaboration when we saw a problem in the community, a growing problem here in the disparity in health outcomes as it relates to COVID-19 in communities of color. And also, as the mayor has rightly pointed out, for some time now about what's happened across the country in communities that have had larger curves than we have and have gone a little earlier, we could see what was happening, and we can anticipate those seeing that here at home, and being able to pull this collaboration together to provide better access to healthcare coverage, I think is a great thing to do, and I really appreciate the partnership of all those involved to make this happen. So thank you all again for covering this today, and I thank all my partners here for making this happen. Take care.